I'm so honored to be here and to be sharing stories with all the three experts. The theme is Future of Silver Economy. Silver economies actually have interesting meaning. Before we start, please imagine with us before we go deep. So at the moment, Thailand, we have elderly, older than 60, that's elderly, right? So I think you are still young, you're not elderly yet. You're still around with me on the panel. It's 20% of the country, but in 10 years, over 60 is going to be more and more. It's going to be 1/3 of the country. And that's not a small group of people. Of course, it's going to make impact to the economy and also to the healthcare in so many sectors and also into the insurance businesses. We're going to find the answers together. What is it happening? Of course, this is ongoing. It's not just here. It's going to happen fast and it's going to disrupt. What is it going to be the challenge to us and how does it work with us? I'm going to ask these three. Ms. Proud, she's representative of the hospital, and Dr. Nart, representative from the wellness, and Dr. Boonchai, he's a representative of the government who look into the data. I'm asking about your experiences and your definition. What is silver economy? What's happening right now and what's happening in your future from your perspective? I'm going to start from Dr. Boonchai first from the government sector. Good afternoon. I am already silver. Sorry, I'm already retired for many years actually, but I'm still working. So when I was invited to be on stage by InsurTech, I tried to think about silver economy. How is it like in my perspective? I think that we live in a society. I'm already silver, there's if 20%, that's already silver economy. In Japan, it's higher than this. So once you are in the zone, in the society, there's two perspectives. One is that how does the elderly, are we still helpful to the community or not? How are we going to work through? There are discussions on the opportunities from the people who are older than 60, but actually, in the old definition, but actually, lifespan, it's like 80 or 90 already. Lifespan kind of extend. The experiences, the energy is still there. We discuss a lot with the silver economy in the perspective of opportunities of the people who are older than 60s. How are they, but in another way, in contrary, when we get older, there are more opportunity for them to, the body, their health to decline. So there might be more diseases and also their physicality would kind of slow down. And there's also chances for new generation or for the community to, to come up with innovations, to have business models that would make your life longer. And also it could, I kind of walk around and check out all the booths of the InsurTech. There are 2 or 3 booths that I discussed with them in health insurance. And I worked with data for in the hospital, in the system of the public health. And I understood about the claim in the insurance system. I kind of know about it. So I'm really interested, but I see that the general insurance, OIC, I used to work with them as well when I was a secretariat under the Ministry of Public Health, and I discussed with them about the insurance. How is it supposed to be? That's my perspective. Thank you. To put simply, you look at it in 2 ways, like how will you take care of the silver people, right? Secondly, how would you take care of the younger generation, like my generation, that in the future I'm going to follow you to the silver zone, right? How are we going to take care of these people? There's 2 perspectives. When you talk about this, let's move to the hospital. On the perspective of MedPark, of Ms. Proud, you look into silver economy. How, is it changing? How does it change? Is there any challenges now? Are they? Well, when we look into silver economy or silver age, I think that silver age now is not the same as before. Definition has changed. When we look into like elderly in the past, we talk about one type of persona, maybe not active as the elderly now. I have to turn around and ask you, like, Ajahn, sir, you feel that you're old already? No, I am older, but like my heart is young. I'm still active. I'm still having fun with life. I want to work, continue working, of course. And so I think like you define with age. At the moment, you can't just do in one dimension, right? You have to look into how active the person is. What is the lifestyle? In the past, we talk about the elderly. We thought about what? You have to have a caregiver. You have to have someone take care of them, caretaker. You know, you have to have nurse to facilitate. But at the moment, those who are 60 or 70 walk around strongly using hospital app, checking to their own data. They know their own rights to claim, and they have more education. They're more well informed, and they know more. They're more aware of their rights, and they have higher expectations per se. So at the moment, the needs of those who are getting older already in the silver zone, you look into the longevity rather than just living old. And also mobility, for example, if you're old, would you go to the toilet? Would you be able to do it yourself, or you have to have a caretaker or a nurse? This is becoming more and more important. One thing that the hospital had to adjust is the lifestyle medicine. We also do it, but preventive care or early detection, or, you know, even though checking genetics so that we would be aware whether we risk to have any kind of diseases, or we have to do if we have enough muscle mass to maintain the lifestyle, to feel that we're independent. We can do whatever we want, right? So we can live normally, a lifestyle medicine, that kind of thing. Just to make sure that they're confident that when they get older, when they feel like they start to get old, they can still handle their own daily life, and you have good quality of life. That's kind of long life, good quality life. That's the extension of what Dr. Boonchai mentioned. Taking caregiver, well, they don't need caregiver because most of them are independent, and they try to maintain their ability to live free, to live. At the same time, the ones who are sick, we have that group as well. But we might look separately into two groups. Yeah, that's like Dr. Boonchai said that, but you kind of clarified further from hospital perspective. Let's move to Dr. Nart. She's my senior as well from the same university. She also has been handling medical on the healthcare. We talk about longevity, and health influencers talk about it. And now people kind of keep emphasizing it. Longevity we don't want everyone to be 100 or 120 years old, but how do you keep your freedom, your independence, maintain the quality of life as long as we want? And the root coming from preventive medicine, changing your lifestyles. Dr. Nat, can you share what is it, the silver economy in your definition, in your wellness definition? Like, it's going to be many, many years from now. How do you look at silver economy? What are the details we're supposed to know? When you talk about silver economy, it has been mentioned many, many times. And we talk about aging population. Aging population came first. In the perspective of Thailand, is aging. We talked about aging 10 years ago in Thailand. But at the moment, silver economy isn't about aging population or age population of Thailand, but it's about longevity. It's about the population, everyone in Thailand that would live longer. At the same time, what we want to focus on, align with what MedPark mentioned, everybody really aim to have independence, to have capability to rely on themselves, to be independent for the longest time. And you have to be, we have to minimize the dependent time. This is the main goal. This is why we call it, those who are above 60, we don't call them elderly anymore. It sounds sad, a little bit sad. It sounds very disheartening We call it the freedom age then, 60 years old plus. Freedom age means what? It says a lot about us. If we can take care of our health and maintain until above 60, 65, and we can still continue it for a long time, and we can be independent in the physicality and your brain and your mental health and your also financial health as well. This is going to be something that is the end goal for Thailand, that we're going to be creating the good longevity population. They can be independent, and also it reduces the burden for the government. And of course, we're going to continue doing this. And each person, a lot of people enter the freedom age, and they carry NCD, not the freedom age, but not free. That's going to be the burden for yourself, the family, community, and government too. One thing that I feel that is good about awareness, when you raise awareness for the young generation, I feel so good about that, because the one younger than 35, 30, they're so active, they're so aware about this, about longevity, and they try to search for information. They're eager to take care of themselves by using devices, using anything, the Whoop, the Loop, or whatever tools you insert that to monitor their own behavior. They check their parameter in terms of healthcare. But what is the most concerning in Thailand is a group of 40 plus to 60 at the moment. And these are the silver tsunami of Thailand, is the wave. This group is entering 60, over 1 million a year. And if this group is going to be carrying NCD or any problem, financial problem, burden of debt, this is going to be continuing. It's going to be concerning for Thailand. Silver economy, in my definition, is about taking care of everybody so that you would go into the freedom age and longevity and have the equal good quality of life. When you talk about NCD, it's the non-communicable disease. This is quite common. So raise your hand if you have high blood pressure. Anyone who have high blood pressure or low blood pressure? 1, 2. Okay, secondly, cholesterol. High cholesterol. That's like, oh my God, we have healthy audience. Nobody raised a hand, not much. What about diabetes, high sugar, or kind of almost high sugar? No, none of them. Are we on the wrong stage? Nobody wants to raise the hand. Maybe they feel ashamed about it. It's 10%, I think they don't want to raise the hand. So NCD, just as she mentioned, this is the public health issues, and any hospital like us, Kun Boonchai or anybody here, we see more and more NCD. Just to show this for insurance company, we talk about the AI technology and innovations. I want to ask you as well, Dr. Proud, Miss Proud, you see from the perspective of hospital, the change of the silver economy. Do you use any technology to help in your hospital? In the past, when we talk about the patients or when we design the experience, in the past we talk about segmentation. Have you heard about it? Like this age, this gender, this type of people would do this and this and that, A, B, C, D. But you do segmentation. It's kind of old school now. Now we try to focus on persona. Persona is what? The group of people who have the same needs. For example, if you're the elderly group, when we mention that, it's not everybody in the age group. They may be different kind of active. Like the NCD, the diseases that they come to hospital, not the same diseases. We have to focus on the individualized care. And for example, functional status, what is it? What's the function or what's their passion? Some people, they're an athlete, professional athlete, they might focus on the movement. They worry that they have mobility, right? They worry about mobility comparing to other people who are like white collar. Writers might worry about cognitive clarity of their brain function more than the athlete, right? And so when we decide the experience for the people, we have to think about their lifestyle. That's the main thing. Like, what's their persona? what are their needs, what is the goals of each person, the differences between them. So in conclusion, it would lead to empathy. Like when we talk to the patient, we try to understand them as much as we can. We understand the stories, and we will be able to design the individual care according to whatever they need. Talking about technologies, I may not talk about it much, but technology is a tool. I'm kind of the advocate on the human touch. Tech, it's something that when we bring technologies in the context of hospital, we think that this is something that kind of suitable, helpful, let's say, is when we use technology to replace the task that you don't actually need human at all. Anything else that is the teamwork, let's say insurance, if it's insurance, we use technology to kind of tackle. You can use it to be more automate, and it would reduce or streamline the process, helping the staff or helping the nurses to do the mundane things, right? So then the nurse can focus more on the patients. There were research that one nurse in 12-hour shift, one nurse in the wardroom, they spend the time face to face. You know how long they spend with one patient. Can you want to guess? You can raise your hand, your fingers, like anyhow, like 12 hours, 5 hours. Okay, the answer, nobody say anything. 1 or 2 hours per 12 hours. That means what, 12 hours? Only 1 or 2 hours to the patients. And then the rest of the time, what do they do? The rest of the time walk around between counter to rooms and then back and forth. That what? Linking to space design. How do we design a space? How do we foster a relationship that like between providers and the patient? How do we help on that, right? So the rest of the percent is on the documentation. That is a lot overloading with documentations. And no nurse or doctors or medical staff will be working on this, and they don't want to do documentations. They want to focus on the patients and improve the quality of life and better outcomes. And so in my opinion, the tech that will be helpful are the ones to be helping streamline the process, doing mundane tasks, paperwork, document, anything you can cut out, anything that you can automate that would allow the health worker to focus on the patients. Thank you.
So simply said, tech is an enabler to help the healthcare personnel or the medical staffs to do their jobs so we can return that time to the patient. That is right. And moreover, there is no AI who can hold your hands whenever the bad news come. Right? So this is why it's not going to replace anything, but you need to know how to use it. The question is, how can it enhance our human relationships? But how about in terms of wellness and preventive medicine? Can we apply innovation and technology like at Chiva-Som? I actually really love Chiva-Som's concept. Can you share with us? Because everybody feels very good after they have left Chiva-Som. So there are some case studies from Chiva-Som. Chiva-Som is an international health resort in Hua Hin, right? We are in this business for 30 years and we receive a lot of world-class awards and recognition thanks to the fact that Thai people has really good hospitality mind and all the services. Especially, we are very good at spa. But now, we already start applying technology in managing our customers' data. We don't call them patients, they are our customers, our tenants, because our customers are sometimes, they are regular customers, so we can keep track of the data. And eventually, it allows us to provide personalized plan, so we can adjust and take care of our customers' lifestyle, because the reason why people come to Chiva-Som is because they want to adjust their long-term lifestyle so they can enjoy better health in the long term. So besides of using the customer data while they are staying at the resort, we can use the same technology to help us follow up with their information back to their hometown. For example, if they are not living in Thailand, when they go back to their hometown, can they maintain their lifestyles accordingly to the plan? Sometimes they are very nice at the resort. They have good, healthy routine. But when you go back Sometimes it doesn't. But with technology, it allows us to follow up with our clients. And like I said, technology is meant to help humans work. This is actually one of our strengths in health and wellness industries of Thailand. It is about human touch, our skill, our empathy, our hospitalities. For both medical and hospitality staffs, this is the strength of Thailand. But how can we help the medical and the hospitality teams who takes care of not just the healthcare and wellness? How can we work together more effectively? And that goes to technology. I actually was about to ask that question because you are in health information for quite some time. I would like to hear from you. Like what you said, we have a lot of data, and the data is growing with technology, with all the available data from all the institutions and hospitals. Is there any information technology that helps improving your customers or patients' experiences, or maybe to serve their demand better, or even to help with the service provider? Like I said, most of my work involves health data, and that includes the data with the insurance and the clinical care. I am a clinician. My background is a clinician. I am clinician first for more than 10 years before I switched to informatics for the last 20 years. What I have been talking about were actually, it was pretty much like precision medicine. So for sick care, it's precision medicine, and the technology has gone as far as genome-wide. And if you still remember, the last year's Nobel Prize in medicine went to, I think, Google DeepMind's technology, wasn't it? That it helped us understand the protein configuration and allow us to develop the medicine much faster. I mean, by many times, like from 20 years, it went down to months from 20 years. What I'm trying to say is precision medicine is not just about personalization, but it has a lot to do with economy. So the cost is higher every day, especially for many patients. But if you suffer from cancer, you used to spend 6,000 baht per one tablet. Just a pill, 6,000 baht. And there used to be a case who suffered from genetic illness. One injection cost the patient 64 million Thai baht. Yes, we have that in Thailand, surprisingly. So in terms of economy, when you start talking about longevity, the expense keeps higher, and that's one of the country's risk. For young people, like even 20 years old, you will become 60. People don't want to have kids because they will be in trouble. It will become a huge burden, and it will become the country's burden if we do not do anything. And once you have gotten into the aging society era, like in Japan, how things are going to be like? Are we ready? Are our public health system ready to assisted living for older people? And do younger people have enough savings to become independent with assisted living in the near future? And that goes back to preventive care and wellness. Again, it goes back to that. Now, in terms of technology, I believe that everybody already used video call, for example, right? We are all familiar with video call. We can call everybody on earth. It has become very normal, and that includes remote monitoring and telemedicine and telemonitoring. These are becoming common, and there are more and more gadgets that allow us to take better care of ourselves. But when you talk about insurance, the reason why I say that it is an opportunity for the insurance is because in Thailand we have the universal healthcare system, right? Everybody has your healthcare insured by the government, and you have your own private insurance, and we know that the universal healthcare system is in trouble. The reason is we need more data. With enough data, we can develop, just like Chiva-Som, they develop their customer profiles. Would it be better? How would it be like if we have enough data that allow you to see the data from hospital 1, 2, and 3, the primary, secondary, and tertiary hospital, well connected. So you know when was the last time you got your vaccine, or if you have any allergy. This is not happening in Thailand yet. And this is a very big issue in Thailand. And many countries are facing it at the same time. But many countries they are very successful in trying to connect all of this information. For me, I think our health system needs transformation, and prevention and longevity is part of the mechanism that allows Thai people to be, besides of living longer, but becoming more independent and also healthier. And so let me add a few more points, because as we are talking about InsurTech today, one of the hot issues today is, as we know, in terms of technology for insurance industry, you say that AI and CRM helps you with call center. Call center is simply done. And the next step is to provide automated agentic AI to provide you the answers and helps responding to your customer. The point is the actual data from Thai people, like Dr. Jirani mentioned. We cannot really integrate the Thai people's data, and without integration, one of the biggest challenge is fraud detection, especially in insurance. And we know that there are issues from the consumers and the providers side, and even the insurers, and even the insurance companies. How can we make sure that the data are fully transparent by using technology? And especially developers, are you hearing me? I think this is your role. This can be an opportunity for you. So when you want to think about any business model or financing model for Thailand in order to subsidize the hospitals or the providers, or maybe is there any technology that can help them make the data more transparent and connected? Because we want to start by detecting the fraud cases, right? I don't know if we have any customer from the public sector, because I already told the organization, because insurance is not about the government. I'm sorry, it's not about the private sector. It has a lot to do with the public sector. So we should invite maybe the Social Security and the HSO and the Comptroller General, who is the biggest champion of insurance, right? 400 billion baht of health expenditure is under your care. So this has a lot to do with our system. We need to have enough funding to support our silver society, or the coming silver society in the next few years. We are having up to 20-30% of populations who will become silver age. Do we have enough budget to take care of both sick care and preventive care? So why don't we hear from Dr. Nart and Dr. Miss Prow? Because Dr. Boonchai just mentioned about integration. What do you think about integration? And would it be possible? Will it benefit your agency? So let's start from something very small. As a company, maybe if you are general insurance or PA or life assurance, if you can connect the health data and lifestyle data from the policyholders, it will help you track their customers and provide better incentive if they live a healthy lifestyle. So we don't want to put penalty on the patients because they already have to pay more for the premium, but we should give some benefits for the people who takes good care of their health. If they live a healthy lifestyle, it doesn't matter what kinds of tool you are using for the tracking system, make it available on your company's application. I think this will be very useful, and it is already possible with current technology. So at a very small individual level interaction between the customer and the company, that is possible. But at the macro view, at the country level, I'm still not quite sure because there are so many challenges. Our data are truly fragmented, especially health data. For me, if you ask me, most of the time I go to Chulalongkorn Memorials and Bumrungrad or MedPark hospitals, but all the data are not connected. They are fragmented, but this leaves opportunity for fraud too, besides of being fragmented. And it encourages redundancy and less efficiency. So I would like to invite everyone to join me. If we have this technology, would it be possible if we can merge all of our people's health data all together on the same big data with an organizer or a manager, a trustworthy organization or agency who can protect your information, somebody who takes care of your data that allows you to get good quality service everywhere with accurate information. And there's another thing we should consider. Once we have more older people in our society, we will have a lot of Alzheimer's disease patients, and that is another challenge because Alzheimer's patients cannot really manage their assets technically, especially when it comes to healthcare. This might not have a lot to do with the tech directly yet, but for the insurance company like General or PA insurance company, please help me think if there's any third-party possibility to help managing these patients, especially Alzheimer's disease patients, to manage their assets and still allow them to transfer their money to maybe the healthcare institution where they need services. When I was working with the Thai Red Cross, I used to be in Sawangkhaniwet for 20 years before I switched to wellness. I used to work with lots of older people in my foundation, and there were lots of older people who came to me and told me that, hey, can you help me looking after my asset? I can give you all money I have, like 50 million baht. While I'm living, please help me manage my money. But once I'm away, you can have all of that as donation for the Thai Red Cross. We have heard about that, but that is not the Thai Red Cross Association mission, so we cannot do that. But it allows me to see the gap. There's a demand in the market, a huge demand in the market. And that might have a lot to do with the life insurance or even the financial institution. So maybe you can think on behalf of your patients. Now let us hear from Proud. I think Dr. Nart, what you mentioned, I strongly agree with that. Because once we can start from a smaller scale, like sharing the data between the company and the patient. And actually, it is already required in the insurance. You need some medical history and, if possible, the lifestyle. If we can start with the insurance company, that will be very good because we cannot really start with a private hospital because of the data issues and there's PDPA and we are a private entity. If we have some intermediaries who can help us regulate the data and most importantly, to have an intermediary, the intermediary must be a truly trusted party because we know that in Thailand, we are trying to do this for a long time. We are looking for a way to centralize the data, especially people's health data, so we can share the benefits together. One of the reasons why we don't see it today is because of trust. Thai people might not have enough trust in this third-party intermediary, and let alone making this happen. But if we start with the insurance company, that might be a very good start. Another thing is actually following what Dr. Na just mentioned. The fact that the insurance company would like, actually I would like to invite the insurance company to start thinking about ROI from preventive care. I mean, we can see from many cases, insurance companies, when you pay out, you always think about if it's really necessary, but there should be some research or some study or some research on the result of the preventive care, how preventive care impact your claim cost. For example, with this kind of treatment, with this kind of medication, starting with strong dosage, for example, would it be possible to reduce the overall cost across the lifetime, for example? Traditionally, the insurance hardly pay for preventive care, let alone wellness. So I think we should have more studies to verify this, how this impact the total cost so we can move forwards together without getting rid of all of this option. We need to build upon these possibilities. So that's my thought. And I already received a signal that the time is over. Lastly, can you leave some final words to our audience, especially for the insurance and insurance tech companies? What you think on behalf of the public, private, and hospitals and wellness? What the future for the silver economy is like? Actually, it's not the future, it is now. Actually, the silver economy is now. What are the opportunities that they can continue to investigate? Maybe Kun Prao, maybe 30 seconds, can we keep it short, please? Okay, so the issues that we are facing at our hospital at the moment speaking of insurance, we know that managed care is very expensive. The cost of managed care is very expensive, and we are hitting the stage where we are going to be like in the United States. The administrative cost is burdening, and each hospital is suffer from cost, and we are running out of nurse. People who go through the insurance, we really need these people to help us make sure that we are compliant and we can work with the insurance companies. We need a lot more workforce, and it is quite a growing cost. So if I can ask something from the insurance company, why can't we work together as a partner? So maybe we can discuss the possibility whether if we can find a middle ground somewhere where we can meet what is acceptable, what is possible or not possible. We would like to work closer to you. Dr. Nart, wellness, 0 baht wellness is possible. Let me tell you, wellness is not actually expensive. It looks expensive, but actually wellness is start with the right mindset and with the proper lifestyle. You start with the right mindset, and that will lead you to a more appropriate lifestyle. So I would like to invite our insurance company to actually invite your policy holders to improve and lead a good, healthy lifestyle with the right mindset to take care of themselves. And if possible, give some incentive for those who did good. Dr. Boonchai, please. I might talk about health insurance in general. So I know that you are all experts, and you know that we have universal health care, right, in Thailand. We have that 30 baht scheme, and there are 48 million people under this care, and 12 million people under the social security, and there are civil servants and another. Actually, 99% of our 70 million people are already covered under certain insurance scheme. And on the top of that, we have private insurance. Or for those of you who are local Thai people, you also have a different kind of insurance too. And this amount is the fund that should be supplied to the hospitals and the insurance. But there's another fund that you already forget. Do you remember that you have to pay third-party accident tax every year if you drive a car, right? 100 plus baht every year. You need to pay for that, for the third-party accident coverage. Actually, this is one of the guarantee. It doesn't matter if you have insurance or if you are covered, you will get certain compensation. So we want to make sure that you will get treatments. But as a matter of fact, whenever we submit the claim, the insurance company might not gladly pay because they say that you don't have the case report. Sometimes you don't even have the police notice. Normally you try to negotiate with your counterparty, right? So you can see that this budget hasn't been supplied to the country's health system. Even though it's possible, I understand that OIC is overseeing this budget too, and you have some discussions for many years. So if you ask me, maybe if you are an insurance company, you can use the technology to help us, I don't know, create certain rules or procedures that allow us to connect the healthcare system, the public health system, to pool the budget together so we can take better care of our people, not just from the sick care, not just from the preventive care. Actually, I think the emergency care can be part of this. Thank you very much. So lastly, for the InsurTech companies and our insurance companies, let's discuss the possibility for the silver economy. We are not just paying the claim, but we can be partners who help taking care of the policy holders. And that can help Thailand becoming more secure and enjoy our healthy life longer. So I would like to thank our special guest today for joining us in the panel.
Audio Jungle.